Naresh, we welcome you, sir, for this international webinar. Thank you.
I think it's my part now. So thank you all for inviting me, especially Monroe sir. Actually, he was my my childhood teacher when I was in like around primary school. And anyways, thank you all the dignitaries for sharing the platform with me. And I'm honored to be invited to this CKM Arts and Science College webinar. So one thing I would like to remind you all about my experiences and the words about CKM College, because I've grown up in the Shaipet, where it is a landmark. I mean, the CKM College is a landmark in our area. And I was reminded by my father about the educational institution as well as the hospital built by Acharya Chandrakant Garu, because my father used to say about the greatness of his who worked relentlessly for the welfare of the people in Warangal. That used to inspire me a lot about Chandrakant Garu. And another one is about, I want to share almost most of my family members. They were all
Dr. Ranjit, please unmute yourself, please.
Yeah. Actually, my father was a basketball captain in CKM College, like around the 1960s, and even my brother-in-law, as well as my elder sister, my brother was an alumni, and even me. But I discontinued from my graduate studies and joined pharmacy. So almost my whole family, alumni of CKM College. I feel honored to be invited to present some of my research works over here. So that's all about the introduction. And probably now I would like to share my screen to explore some sort of research progress that I've been working on for over a decade, almost like 2012 to 2022. So probably I'll be trying to share some of my progress throughout this area. I mean, throughout this period. One sec. And once again, I really thank you and wholeheartedly for inviting me to present my work over here. So coming to the topic, the topic entitled a smart nanomachinery-based drug delivery systems for cancer therapy. And I forgot to say you thank you for the kind words. Dr. Udaya Lakshmi. Thank you. Yeah, probably PowerPoint. So the title of the topic is about smart nanomachinery-based drug delivery systems for cancer therapy. As I was motivated by the demise of my mother because of cancer. So I was decided to work only majorly with a focus on cancer therapy. So most of my work is related to cancer therapy. So, but actually my research is divided into two different parts, but majorly focused on cancer therapy. One is about drug delivery and another is about tissue engineering. So we generally in our lab, we focus on these two different areas using various nano as well as micro delivery systems. Tissue engineering doesn't mean how to say, not the bulk scaffolds, but we make delivery systems for delivering cells. So these are also a part of delivery systems, which I'm going to introduce to you. So both these are, one is drug delivery and another one is about cell delivery. So coming to drug delivery, actually, cancer, it is being the most dreadful diseases among various kinds of ailments, like even cardiovascular or different ailments. Among them, the cancer is the most dreadful one, which accounting for millions of deaths every year. So, but the thing is, we have to, the motivation for this particular cancer therapy is, one is early diagnosis and giving the right treatment. So there are different kinds of treatments available for the cancer therapy. One is the first one is surgery. When you diagnose it, you can directly remove it through surgical procedures. And the next one is about the therapy based on radiation, pumping radiation, and you can kill the affected cells with a direct radiation therapy. And another one is about conventional chemotherapy, where you can deliver drugs, the proper targeted drugs, to the cellular level, and you can achieve some sort of cell death. That's what we work on. We majorly focus on developing delivery systems using chemotherapeutic agents. I mean, the small molecules or even proteins and immune therapy as well. But the problem with the chemotherapy is there are quite a few problems, because most of the chemical molecules or even small molecules having poor bioavailability, like you don't get the required amount to kill the cancer. This is first one. The reason why is non-specific distribution. As we have different kinds of administrative procedures, even you give on IV into the blood, but still you couldn't achieve the required amount in the cancer cells specifically. So that's one of the reasons as well. Another one is about lacking of targeting ability. These are not really targeted because you need a specific targeting ligands to target the cancer cells specifically. So these problems of non-specific distribution and lack of targeting ability leads to systemic toxicity. Like it can also affect the normal organs like liver, lungs, and all, because the whole the body get accumulated with the cancer molecules. The reason is you can see on the left side, you have a traditional drugs, the chemotherapeutic drugs, which are pumped into the blood. You can get into, you see it can be accumulated throughout the body, which is really toxic enough for all the major organs in the body. But if you use some sort of nanoparticles, there is a specific way of transportation of the nanoparticles, specifically through several targeting mechanisms like EPR, or maybe using the targeting ligands like folic acid and all, or HA receptors targeting. Based on these targeting moieties, you can specifically target to organs which are, the necessary organs, so that you can have enough amount of drug molecules into the specific organs. That's the reason why we have some sort of molecules like maybe doxorubicin or even methotrexate and other molecules are input into the nanoparticles, and they are administered through general procedures where it can be targeted to cancers. So the benefits of this, particular nano particles is by, it can achieve targeting, as I said just now, and the multifunctionality, like you can add more or two or more drugs to get more and more functionals, like not specifically targeting to one through one pathway, or you can also target them by multiple pathways. And the next one is about you can deliver multiple drugs by conjugating through a different functionalization or immobilization procedures, where you can put inside, or you can surface conjugate on the top of the nanoparticles, and you can you can also make one or two different drugs can be placed into the nanoparticles and deliver. By these ways, you can improve the therapeutic index, as well as you can reduce the toxicity effects, unwanted toxicity effects by these nanoparticles. And not just drugs, but also you can also deliver like siRNA or even DNA. The different nucleic acid, which has long non-coding RNAs, which are effective against different cancer cells. Treating different cancers. In addition, we have several kinds of inorganic particles like copper sulfide or even gold or silver nanoparticles, where you can use photo related efficacies, like if you give a light on them, they can try to show the surface plasma resonance and try to increase the therapeutic window by the utilization of light through generating ROS, reactive oxygen species, where it can also damage the cancer cells. So basically, the passive targeting as well as active targeting, you have different kinds of targeting. Like as I said to you just now, we have a ligand on the nanoparticle where it can directly target only cancer cells. This is one way. Another way is about the passive targeting. The passive targeting generally happens to be in this way. The blood vessels, due to rapid growth of cancer cells, the blood vessels get the what do you call, the gaps between the blood vessel lining, the endothelial cells, where it can create the entry of nanoparticles without the use of any targeting molecules. So it means in this case, we need a special targeting molecules that can target cancer. This is one way. And another way is about without the use of any targeting ligands, the nanoparticles can be supplied to cancer through this EPR mechanism. And in this case, we have different kinds of nanoprobes that are being researched, majorly functionalized to achieve biocompatibility as well as cell targeting. So these are different kinds. One is silica. Basically, I work on silica nanoparticles as well as layered materials like Elliots and Maxines. And even we have quantum dots, the copper sulfide related or even gold, silver nanoparticles as well. These dots, silver dots, also can be used for cancer therapy. And we have other organic related molecules like liposomes and the polymeric nanoparticles. These delivery systems have no special attributes, but they just can convey as much drugs as possible, because they have enclosed a high specific surface area which can enclose as many drug molecules. So, but my research work is related to, as I said just now, about MSN mesoporous silica nanoparticles. Generally, the particles look like this, where we have enough specific surface area. Like these are the attributes the MSNs offer. It has enough surface area to enclose as much drug molecules as possible in the porous surfaces, as well as even conjugated on the surface as well. But here, the silica nanoparticles just act as a vector, same like a polymer or liposome. They just act as a packet for carrying drugs. But the recent advancements over a decade has increased the functionalization of these MSNs through different kinds of conjugation criteria. They used to adhere metal nanoparticles, or even create a Janus type, or even immobilize nanoparticles, or even put some inorganic nanoparticles like copper sulfide or even gold or silver can be conjugated to close the cap, and then drugs can be loaded inside as well as close the cap for efficient delivery. And even in some cases, like utilization of iron oxide, they create a core shell. So this is how the nanoparticles can be loaded inside as well. So, but my area of research interest is about conjugating the framework. Why my thought was changing the framework, because the silica is like, we have some sort of degradation problems and compatibility problems which are harmful to the cells. So I decided to change the framework of the silica, so that it can easily load the drug and easily degradable, and having compatibility of reducing the silica density inside the particle. So these three main aims pushed me to enclose metal species inside the framework. So this is what the actual the core design of this research. So we try to use divalent metals as well as mostly divalent metals, copper, zinc, and iron. So we try to enclose it into the frameworks like through this way. While synthesizing, we try to put metals inside. Why? Because these metals would like to create free radicals. These free radicals in the acidic environment also kill cancer cells. This is one. And the second reason is this copper or these divalent metals form conjugation reactions with some sort of drug molecules, which can load more as well as deliver specifically in the acidic environment, that is cancer. So the reason for this one is about, actually this image is not really showing the release, but indeed in the next images I can show you. So the copper, the usage of loading copper inside the framework is first thing to create free radicals, like through this mechanism, and toxic free radicals which can kill cancer cell. And the second thing is loading the drugs which can specifically release in the acidic environment, that is cancer or bacterial bacterial infections as well, because all acidic environments can be feasible to degrade this linkage between the drug molecule as well as the metal, because these coordinations are pretty sensitive in the acidic environment only. So when you administer these through blood, so blood pH is around 7.35 to 7.4. So these are safe. These interactions may not be, disassembled. So the drugs are safely taken to acidic environment, especially cancer and bacterial infections as well. So it can, after traveling in the acidic environment in cancer cells, these coordination interactions can be broken down and the drug is released, as well as this copper access generating free radicals to kill the cancer cells. So we have a double effect using this metal doping MSN. So this is the mechanism of ROS generation through CDT. So the iron-based ferroptosis pathway. So we generally call it as penton-like reaction, where the copper chemistry even acts similarly by production of OH dots, this free radicals. Why these are produced more? Because due to this SOD pathway, H2O2 levels are higher in cancer cell rather than normal cell. So even the copper MSN, if they enter into normal cell, it couldn't create as much free radicals than normal cell. So that's the reason why these are mostly beneficial to, these are mostly targeted, or high free radical generation is happen to be favorable only in cancer cell. And in another work, we try to generate the same copper MSN, and we try to load the docs through same coordination interactions like Cu and H2, this coordination interactions. And after that, we try to coat the liposomes for efficiently targeting or entry into the cancer cell through overcoming this MDR, multi-drug resistance. So the MDR itself is like, if you have a normal drugs encapsulation or normal drugs delivery, these pumps, even after entry, these pumps will try to kick out the drug molecules. So we try to put the drug molecules inside the silica and coat the liposome as well as TPGS. This TPGS will try to stop the MDR pump in the cell so that the drugs can be delivered feasibly inside the endosome. And this copper chemistry as well as DOX chemistry works out together to create OH dots. So that you can see here, we confirm the copper loading through shift in the XRD peak. And we have a specific release. As I said you just now, it can be released only in the acidic environment. So in pH 5.5, you can see the release, whereas in pH 7.4 in blood, it is very low, not even 5%, but whereas in 5.5, it is over 50%. So this is significantly higher in acidic environment rather than the blood pH. And this work has been highlighted in ACS BSc as a cover image. We were asked to make a cover image of this work, and it was highlighted on October 2017 in ACS. So in another case, we try to replace the copper with the zinc, and the similar way we try to create the same story happen here. Even zinc try to show the release of dogs specifically in the acidic environment, where you can see the dogs was immobilized inside the silica frameworks, and this zinc emission dogs is coated with the CSPT, the chitosan encapsulated with PT nanoparticles, and which were coated over the the MSN, where here not the the free radical chemistry, but we here try to make the entry into the MDR cancer cells, like creation of the pathway. The MDR cells are almost pretty tough and have a tight bond between the cells. So these PT nanoparticles decorated over the MSN surface will try to create the gaps, and then enter deep into the tumor. Generally, when the nanoparticles were administered, the nanoparticles act only on the surface of the tumor. But here we try to have a entry of the nanoparticles deep into the tumors, so that the deep tumor cells can also get access to the delivery system. This is what the idea is. So here with this PT creates gaps inside, and then try to damage the integrin proteins between the cells, so that the other nanoparticles behind can enter into the deep tumors, where we have confirmed through different characterizations. Probably this has been published in 2020 CEJ. Impact is around 13 now. So the mechanism and synergism acted like this. Not only the deep penetration, but also the PT ions, the PT nanoparticles after entry also created PT ions, which are also toxic to the cancer cells. And the cell viability slightly reduced, whereas the ROS levels were also pretty higher. And even with the combination of this, the ROS levels are significantly higher enough to kill the cancer cells. And further, this idea was, we try to do the animal experiments, where even you can see the final formulation significantly reduced the tumor growth. So by the craziness of this metal incorporation into silica framework, I got an idea of why don't we use multiple metals? Like, what is the situation of not just putting one, but also two? So I tried to use copper as well as iron to place inside. Then the crazy thing happened that we got to get a Janus type, like an extension, where two similarly charged metals try to bombard each other, and then try to extend the framework as a special shapes. So that lead to this spiro-ellipsoid. I mean, the ellipsoid shape of iron as well as spherical shape of copper MSN lead to spiro-ellipsoid, different shaped MSNs. So even this try to create a large gap, I mean, in the surface area, so that you can load more drugs inside. Whereas the copper alone could create, like, for example, some level of ROS, but whereas if you add iron, the levels of ROS levels increases. So it is really beneficial for us to have more. So this is how it happened, where the repulsions between two positive metals would create a change in shape of silica. So that's what the whole idea is. And even it was confirmed by the EDS mapping, where you can see the iron accumulation is pretty higher in the horn shaped thing, whereas copper is distributed all over, but whereas iron is concentrated on the external end. So because of the repulsions between copper and iron. So, and this is the schematic showing about this. The first one is about normal silica, which creates a hexagonal MSN, but whereas copper also created the hexagonal one, but the iron, strangely, it formed a long rod-shaped MSN. But whereas combination of these two, copper as well as iron, resulted in a Janus type. And even increase in metal amount would reduce the silica density. So reduced silica density would create a lot of advantage. Like, for example, it can give us biodegradation as well as chemodynamic therapy by creating the ROS levels. The more ROS levels, the higher the activity. And the CDT was achieved by the same way with the glutathione ratio, as GSH is expressed more. And even you can see the MDA levels, the cell membrane breakage assay, where you can see with the use of dual metal MSN, the cell membranes were demolished. This is through lipid peroxidation. And these are ROS levels where you can see the CUMSN and CUFEMSN. So dual metal one created more ROS levels compared to the positive control, the hydrogen peroxide. And apart from MSN, our lab, we are also focusing on a generation of dual, the two-dimensional materials called LDH. So here we use two different kinds of materials here. In this case, this two-dimensional materials is based on M2 and M3, which are arranged octahedral way through hydroxyl groups, and it would create a positively charged layers arranged or balanced with the negatively charged ions. These can also be used to create the encapsulation of drug molecules inside, and also the external surface with hydroxyl groups could also be conjugated with the silane chemistry, where you can use any sort of functionalization, or even you can load drugs on the surface as well as inside. So in this work, we try to load the use of same copper chemistry by using this this diamine, and we try to conjugate copper, as well as this copper could be attain the coordination with the doxorubicin. One drug was loaded on the top, and another drug, ascorbic acid, which can also act as an antioxidant, but also it can kill the cancer cell in the interlayers. As in most of the cases, I forgot to tell you that the interlayers are balanced with the anions, because the two positively charged layers were balanced with the anions inside, mostly nitrate, chloride, sulfates, and carbonates. But carbonates are pretty dangerous because it won't allow any sort of small molecules inside. But this nitrate layer is pretty feasible to kick out any sort of carboxylates with the negatively charged, highly negative charged small molecules can be placed inside. And this is the only disadvantage of this material, where it is pretty impossible to load the a slightly positive charge or neutral molecules inside. Even by using this copper chemistry, same coordination bonds breakage, we could also achieve the delivery of doxorubicin specifically in the acidic pH, that is the cancer pH. And even ascorbic acid could be released as much as possible in acidic pH. The reason behind this is these layers were a bit sensitive to acidic environment. So we don't really need any sort of breakaging things, because this material is sensitive to acid. So in acidic pH, these could be broken down. So by using of same material, we have used the hydrazone chemistry, and we try to develop because doxorubicin is a bit large molecule which could not be loaded inside the layer. So here we use this hydrazone chemistry and form this dox hydrazone complex by attaching the carboxylate group, and we try to load inside. So this automatically given us the a release of dogs, specifically in the acidic pH, in a significant way. And this has been published in JBMR Wiley 2019, and where the cell viability of the dogs delivery in specifically in HeLa and MCF cells were pretty high. So by using the same material, we have used this for the intestinal cholic acid absorption. As I said you just now, these positively charged layers could be used to load the the negatively charged species. So for that reason, we have conjugated the diamine as well as triamine, and we make a dendrimer, so that to increase the hydrophobicity of the material and also pull the layer space, so that the cholic acid, which is sequestered inside the intestine, where you can see the mechanism over here. The eudragid coated material as well as the dendrimer, which were entered into the stomach, can be sequestered with the, because we coated here eudragid. The reason behind coating is this could stay safe inside the stomach, where, as I said you just now, these layers were sensitive to acid. So the eudragid layer protects it in the acid, and then when it enters intestine, it becomes naked. After becoming naked, the cholic acid from the liver, this cholic acid could be absorbed inside and then can be excreted, as it could reduce the cholesterol levels in the body. So here we have observed the different functionalization and dendrimer to see the effect of hydrophobicity on the journey of this LDH. And in another case, we use the surface chemistry of this layered double hydroxide nanoparticles, and we try to coat nanoparticles on the surface of this by using the isomorphic substitution. So in this case, as I said, your divalent and trivalent metals are loaded. I mean, the material is based on divalent and trivalent metals. In that, the divalent is pulled out and placed with another. For example, in this case, we used the copper to replace. And after replacing, we try to fabricate, or we try to generate nanoparticles on the surface of the material by using this PVP to control the size of the nanodots. So these nanodots can help in photothermal conversion, as well as this copper sulfide could create as much free radicals as possible. This is one way, and photothermal experience is another way. So that by these two, PTT as well as CDT, chemodynamic as well as photothermal, could subsequently demonstrate the cancer efficacy, where the copper sulfide loading is being confirmed by EDS map. So the findings of this particular material is like we have generated as many metal impregnated inorganic carriers, not just for cancer, but also the exploring MDR multi-drug resistance. I mean, even overcoming the multi-drug resistance through creation of specifically ROS for cancer therapy. And based on tissue engineering, we have mostly we didn't use about inorganic, but now we are shifting into inorganic materials for tissue engineering. But basically, we used as organic materials are more compatible. We used microfluidic technology and created the highly porous polymeric microspheres. So these polymeric microspheres could be efficient to generate the cells loading pores. I mean, the open and the interconnecting windows. Through these windows, the cells can be impregnated inside and then try to let them carry. And these carried cells can be injected to create the tissues inside the body. These act as like microcarriers, cell carriers. So in this way, we have done a lot of experiments on generating these cell carriers, where we can see like using different immunostaining and different staining techniques to confirm that cells were loaded. Efficacy is pretty high, and even with the increasing time, the cells were higher. This blue color dots, DP stains, shows the amount of cells loaded inside, where you can, different culture techniques were used to see how the loading efficiency, I mean cell loading efficiency, is observed. And not just this, but also we have checked the mRNA efficiency, that whether the cells were active inside or not. And even the, with increasing the time period of culturing, we have seen many cells were keep growing inside. So in another case, we use the same microfluidic technology for the fabrication of a blood vessel kind of story, where we use HUVC, human umbilical cord vascular endothelial cells. These can be also loaded inside to create a vessel-like rod-shaped structures. So in another case, also we use the same, the microcarrier story, so that these could be generated by using different kinds of cells. In one type, we use liver cells, and in another type, we use the blood cells, so that it could create a perfect tissue. And this tissue can be used for a drug screening purposes. Like, for example, you can see in this case, these different cells could create the tissue kind of structure. Like, you can create the tissues artificial, so that these tissues can be used for screening many drugs. Like even normal small molecules also can be checked for this. And in another case, we have been trying to explore some sort of 3D printing stuff, where we use the pneumatic 3D printing at a low temperature, so that we could check the efficacy of different materials, different polymers on the growth of the cells. So after using 3D printing, we create a scaffold, and this scaffold was seeded with cells, and see the effects of different polymers and different small molecules on the growth of the cells. So in this case, we have applied for bone engineering, where different factors, osteogenic specific factors, were used to explore the growth of bone tissues. And in this case, the cell delivery version, we have generated different kinds of injectable 3D microcarriers. These are almost 300 micron. It seems we can use a big nozzle syringe to inject into the body directly. We don't need a surgery or anything. These are like normal injections. You can also inject these microcarriers at the specific site, so that you can observe for a long time and observe the cell growth inside. Like, cells could be like, for example, skeletal myoblasts or even osteo-related cells can be injected for the growth. And one more thing is about HUVCs. Like, even blood vessels also can be generated, so that not only just the cell, but also blood vessel can be grown together, which can create a new capillaries. And based on these works, and most of them I didn't discuss yet, but still we have lots of work still under progress, and we are writing the papers. So far we have published like around the last 3 years. I have co-authored around more than 100 for last 4 years, because every year we are pretty productive with around more than 20-25 a year. And recently the citation crossed over. This year, 2021, citation is over 800, and it sounds pretty interesting. And I hope many more to come in the future years. And these are some of the studies which were highlighted on covers of different journals, small AHM and ACS, as well as ACS ME, and materials and others as well. And we feel pretty happy for this, and thanks for the opportunity, as well as friendship and collaboration with different people. And we also thank different funding agencies, like over 1 crore rupees has been awarded in past 3 years. And I just feel thankful to my collaborators. One is Shrike from Harvard, and another Japanese, Yusuke Amachi from Queensland, and Santos from Helsinki, Kevin Wu from Taiwan University, as well as Donghua, Professor Lee, who was my co-supervisor, and Dr. Kai from Fudan University. These were all collaborators. And I also thank them for recently inviting me to hold a special issues on different journals like ADDR, Advanced Drug Delivery Reviews. The impact is around 16, and another one, Bioactive Materials. The impact is around 14 or 15. And Frontiers Journal around 6. We are holding a thematic issues on these drug delivery as well as cell delivery applications. So I really thank them for giving me the opportunity, or let me join with them to hold some interesting and impressive things. And thank you all for your patience. I hope you got my point, what I'm really doing. Thank you. Thank you so much for the opportunity.
Good afternoon, sir. Principal, sir.
I hope you had no interruption with the audio or video due to internet.
Shashidhar, sir. So, thank